You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to. This video is split into different chapters. At any point, you can pause the video, take a break, and come back to the video at another time. To move through the chapters, you can use the timeline, or below the video, in the description, you can see the different chapters listed out, and clicking on a chapter will take you to that section of the video.
In this video, we will explain what happens when you attend your diabetes annual health check appointment. This will help you to understand the different parts of the health check and what to expect. We will be following John, who is here for his health check appointment. He has been asked to take a seat in the waiting room until he is called for his appointment. We are at Water Eaton Health Centre, but if your appointment is at a different GP, the waiting room will look different. During the appointment, some of the equipment might be noisy. You can bring ear defenders with you if you want to. Let's join John as he begins his appointment.
Hi, good morning,
Hi,
John.
are you alright?
Would you like to come in and take a seat?
Yes, thank you.
How are you today?
I'm well, thank you. How about
Good.
yourself?
Fine, thank you.
Excellent.
Got you booked in for what we call your Part 1 diabetic check this morning.
Yeah.
So what happens in the Part 1, if you haven't done one of these before, is that we just have a little bit of a chat about sort of lifestyle. For example, do you smoke? How much alcohol? Exercise? We're going to check your blood pressure.
Okay.
And then we're going to do your weight, check your height, so we can work out what's called your BMI, which is your body mass index.
Body mass index tells us if you are a healthy weight for your height.
And then we're just going to do a foot health check. So we're just checking your pulses on your feet.
Okay.
And then we're just going to check some sensitivity on the bottom of your soles.
Sure.
But it doesn't hurt.
Okay.
Have you got a urine sample with you this morning?
No, I haven't.
Okay. We will also ask you to do a urine sample. You don't need to do that here. You can take the bottle home, do the sample at home, and then drop it back into the practice. And then that urine sample, it's sent off to the lab. And again, it's around just checking some markers around your diabetes. So we'll test the urine sample, okay? And then we take some bloods.
Yeah.
Okay, and the bloods that we're checking are your sugar levels, the long-term sugar levels, so what your sugar level does over sort of 3 months. Once we've done all of that, we'll then advise you to make what we call a diabetic part 2 appointment.
Sure.
And that's with either the diabetic nurse or the diabetic doctor. And during that appointment, they'll just go through and talk to you about your blood results, what your sugar levels are doing, whether there's any sort of next steps around diet, or whether we need to just change or just tweak a little bit of your medication.
Yeah, sure.
Okay. And then if the medication is changed, then we usually just repeat the bloods again between 3 and 6 months, just to make sure that they're coming down in levels and everything's normal.
Okay.
Okay. So, have you had a diabetic check before?
No, it's my first time.
It's your first time, is it? Okay, fine. Okie dokie. So I'll start off by doing your blood pressure, if that's okay.
Yeah, sure.
Yeah.
Your blood pressure is made up of 2 numbers. For example, 120/80. The higher number is called systolic pressure. This is the pressure when your heart pushes blood out. The lower number is called diastolic pressure. This is the pressure when your heart rests between beats.
So have you had one of these checks done before?
I have done, yeah?
Yeah, okay.
The cuff is put on your arm and will feel tight until the blood pressure reading is done. It will then start to feel looser. The machine will make some noise.
And is there anything that you're worried about having the check?
No, not at the moment, no.
Okay, so you're okay with having your blood pressure done?
That should be fine.
Yeah. Okay, so just gently relax your arm. Okay. So this is going to go quite tight on your arm. Okay,
Yep.
it can sometimes be a bit uncomfortable.
Okay.
And we just ask you just to sit as you are,
Sure.
and don't chat for a minute. So you're just going to feel that going quite tight now onto your arm.
Thank you.
Okay, so blood pressure's okay today. Do you monitor your blood pressure at home?
Have done before, yeah.
Yeah, it's always important just to keep an eye on your blood pressure, especially for people that do have diabetes, because we do need to keep your blood pressure a little bit stricter in control.
Sure.
You should aim to keep your blood pressure at a reading of 140/90 or below. This target may be adjusted by your healthcare professional.
So they're the two figures that you're looking for.
Sure.
Okay, so I'm just going to pop that on the computer. Okay, and your pulse was fine as well.
Here, pulse means the number of times the heart beats in an amount of time.
And do you smoke at all?
I don't smoke, no.
Okay, have you ever smoked?
Never ever smoked.
Perfect. Okay, well done. That's brilliant. Okay, that's good. And do you drink any alcohol at all?
Probably about once a month, that's about it.
Once a month,
Yeah.
okay. And is that beer or is it spirits?
Ciders normally.
Cider,
Yeah.
okay. And it's about once a month?
Yeah, once a month, yeah.
Okay, fine. Okie dokie. And do you do any regular exercise?
Yeah, so I go to the gym quite often, anywhere from 2 to 4 times a week.
Okay.
I've got quite an active job anyway, so I'm cycling or walking around,
Okay,
occasional
brilliant.
running as well.
Okay, so you do quite moderate exercise. That's excellent.
Yeah.
That's really, really good because it keeps the cardiovascular going and keeps you fit. Okay. Right, so we're just going to pop you on the scales and then do your height.
Sure.
Okay. So can I ask you just to pop your shoes off for this, if that's okay? And I'm just going to grab the scales. Okay, and if you'd just like to stand on there for me.
Thank you.
Okay, that's absolutely fine. You can step off now. And then we're just going to pop you under the height measure and just do your height. So if I can get you just to stand against the wall, nice and tall, head straight. Okay, so just going to pop this on top of your head.
Okay.
Okay, that's absolutely fine. And if you just like to step away and you can sit down.
Lovely.
Okay, so your weight is okay compared to your height. Okay, so your body mass index is good. Okay, so just keep up the regular exercise.
Lovely.
Okay. Do you have a fairly good diet? Do you eat lots of fruit, vegetables?
Yeah, it's pretty good, decent sometimes. Definitely sometimes it's not so great, but for the most part it's good.
It's good. Okay, you have a nice, well-balanced
Yeah.
diet. Yeah, okay, fine. Okay, so what we're going to do now is just check your feet. Okay, so I do need you just to pop your socks off if that's okay.
Okay.
And then we're going to get you to lie on the couch. Okay.
Diabetes can cause foot problems. It can affect the feeling and sensation in your feet or blood flow in your feet. You might not notice the changes in your feet, so it is important that you have regular checks.
There, a little bit more comfortable for you.
Thank you very much.
Okay. Okay, if you just want to pop your feet down for me, and so I'm just going to pop some cleansing solution on my hands.
Okay.
Because for this part, unfortunately, we can't really feel your pulses very well if we wear gloves. Okay. So, do you normally put any cream on your feet? No. Okay. So, just having a quick look. The skin does look nice and soft at the moment, but it's really, really important that you keep these heels nice and soft. Okay. Because if they get ultra dry, then they can crack. And people with diabetes, they really need to look after their feet to avoid getting infection or cracking. So I would recommend using a moisturiser on your feet on a daily basis. Okay, just going to have a feel of this one. Yeah, lovely and soft. Okay. Yeah, that's absolutely fine. Do you cut your nails yourself?
I do, yeah.
Yeah, that's fine. Okay, just keep nails nice and short. Just be careful you don't cut them too short because of risk of trauma, okay, and infection.
Yeah.
So what I'm going to do now is just have a feel on the top of your feet and then on the sides for your pulses. Okay, so just going to pop your foot up like that. So we're just going to have a feel. They are sometimes difficult to feel, so if I can't feel them, then what we'll do is we'll just pop a little machine on.
This machine is called a Doppler ultrasound. It measures the blood flow through your blood vessels using sound waves.
Okay, not feeling them at the moment, so I'm just going to pop the machine on so we can hear them. Okay, so I'm just going to get the machine. Okay, so what we're going to do is just pop a little bit of gel just on your foot. It's a little bit cold, but what that does help with is with the machine to make the noise. Okay. This can make a lot of noise, I think. There we go, there's the pulses. Okay. So I'm just going to wipe your foot. Okay. There we go. Okay. So what we're going to do now is we're just going to check the soles of your feet for sensitivity.
Yeah.
Okay. So I've just got a little pen here. Okay, it's just got what we call a little filament on it. Okay. And if you can just feel, it's not sharp or painful.
No.
Okay. So what I'm going to do is just sort of touch it on the soles of your feet.
Okay.
And every time you feel it, can you just say yes?
Yeah.
Okay.
Yeah. Yes. Yeah. 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 Okay. Yeah. Yep.
Okay, and then we're going to do this foot.
Yep. Yes. Yep. 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 Yep.
There we go, brilliant.
Thank
Okay, that's great. Okay, so that's the foot check completed.
Okay.
So we can pop you back on the chair, and if you want to pop your socks and shoes back on, that's fine.
Thank you.
Okay.
Cheers.
Right, so what we're going to do next, if you're ready, is take your blood. Okay. Have you had blood tests before?
Yes, I have. Yeah.
Yeah. And are you okay having blood taken, or would you prefer to lie on
should
the
be okay
couch?
sitting
Okay,
here.
so we can do it with you sitting in the chair. So what we're checking with the diabetic blood test is checking your long-term sugar levels. We're checking your full blood count. We're checking kidney and liver, and we're checking cholesterol levels. And it's just a generalised screen, just to make sure that your sugar levels are staying within good limits.
Okay.
Okay, so I'm just going to do that now. So I'm just going to pop some cleanser on my hands. Okay, so we're just going to pop a tourniquet on. It goes around your arm like this, and it goes quite tight, and that's just so we can see the veins. Okay. And we do them in these lovely colours. Okay. Okay. So we're just going to pop your arm nice and straight, and we're just going to give it a gentle tap. Okay, just so we can find the vein. Okay, and you've got a really nice vein there. Okay. Okay, so it's just going to be a gentle scratch, okay, just as the needle goes in, okay, and then we're just going to take some bloods. So we do have 3 bottles that we have to take just for the different tests, okay. Feeling okay?
Yeah.
Yeah. Okay, and then last one. And then we're just going to undo this. Okay. And then we're just going to pop some tape on. Just need you to do a urine sample for us. You don't need to do it now. You can do it at home, and then you can bring it back in and just drop it off at reception. So just a normal urine sample, and just fill it to about there.
Sure.
Okay.
To give a urine sample, you have to wee into a clean jar, which the nurse will give you.
Just pop your name and your date of birth just on the label, and then you can drop it back into the practice.
Okay.
If you can drop it back in the morning, it's better. Okay. So you can do that when you're ready.
Sure.
Okay. Going to send the bloods off today. Okay. So the next part will be part 2, and that's usually in about 2 or 3 weeks.
Okay.
Okay. Is there anything you'd like to ask?
No, I'm good, thank you.
No? Okay, fine. And just checking that you are taking your tablets for your diabetes every day?
Yeah, absolutely, every day.
Yep. Okay. Not missing any?
No, definitely not.
Okay, fine. Okay, brilliant. And lastly, have you had your flu vaccine this year?
Not yet, no.
No, okay. And have you had the flu vaccine before?
No, not before.
Not before, okay. So we do recommend, and that's sort of Department of Health recommends, that people under the age of 65 who have diabetes are a little bit more at risk of complication from diabetes and flu.
Okay.
So we do recommend that you have a yearly flu vaccine. So for your age, because you're under the age of 65, we recommend that you have a flu vaccine that contains 4 elements. So the flu contains 2 group A strains, and they cause the most serious flu illness, and then 2 group B, and that's the flu that's sort of more local, causes local outbreaks. So there's 2 of each in the flu vaccine. The flu vaccine gives you antibodies to be able to fight off flu. It doesn't actually give you flu. So you can't get a flu illness from the flu vaccine. And it doesn't give you a cold either. Okay.
Right.
So it's what we call an inactivated vaccine. So if you were exposed to the flu virus, your body has that facility to fight it.
Okay.
The vaccine is designed to reduce your risk of severity of flu. So it does still mean sometimes you can get a flu illness despite having the vaccine, but the severity will be less and there's less risk of complication.
Okay.
Normal side effects to the flu. Arm can be a little bit sore where the needle's gone in.
Okay.
Sometimes the arm can just be a little bit achy to lift, and that can last for 24 to 48 hours normally. You also can sometimes just run a bit of a temperature, and you may just feel a little bit unwell, only slightly, for 24 to 48 hours. So you may feel you're running a temperature, you may feel like you're developing a cold, but it's what we call vaccine reaction.
Sure.
Okay. So the vaccine goes in your arm. So have you had any major complications with vaccines in the past?
No, none before.
No? And have you had any major allergic reaction to egg or chicken?
No, none before.
No. Okay. Are you happy to have the flu vaccine today?
Yeah, have flu vaccine.
Yeah? Okay. Okay, so we're just going to pop the vaccine up there. Okay, so I'm just going to roll your sleeve up. Okay, so we're just going to pop it here. Okay, so it's going to be a little sharp scratch. Okay, ready? There we go. Okay. There we go. That's all done.
Thank you.
So arm may be a bit achy. If you do feel not very well, run a bit of a temperature.
Sure.
You can take some simple paracetamol that you can get from the chemist.
All right.
Okay. All right.
Yeah, thank you.
That's the part 1 diabetic health check completed. So the next steps, once the bloods are back, you'll see the diabetic doctor or the diabetic nurse to discuss your blood results and also the medication that you're taking. Depending on the blood results, sometimes the medication has to be changed or dose altered. So once we've finished here, if you would like to go to reception and just ask the reception staff to make you an appointment with either the diabetic nurse or the diabetic doctor for about 3 weeks' time. Okay.
If you do not understand any information, you can ask for help.
Any questions?
No, none from me.
No? Okay, and just pop urine sample in when you can.
Sure.
Ideally, if you can drop it back into the practice in the morning. Okay, and then we can send it off to the lab.
You can find the results from your urine test on the NHS app. You can also phone the GP to learn your results. If the results are outside of normal range, a letter will be sent to you.
Okay, cool.
Okay. Nice seeing you this morning, John. Okay,
Cheers.
take care.
Thanks.
Bye-bye.
Bye.
That will conclude your annual diabetes health check appointment.